Hi, my name is Christine Myers. I'm completing my head-to-toe assessment for nursing health assessment 612. My patient has been asked to empty his bladder and to put on a gown for ease of my assessment. I completed his vital signs, his height and weight, and measured his vision, far-sighted on Snellen and Rosenbaum for nearsighted. I'm going to start my inspection of his skin, looking for symmetry, color, any lesions, any masses that I see right off. He's nice and pink. He doesn't look diaphoretic. I'm going to go ahead and move to his head and look at his skull. He looks normocephalic. I'm going to go ahead and palpate you. His scalp is easily maneuverable. I don't feel any masses. Does this hurt anywhere?
No.
Okay. Very good. All right. Okay, just look at me. I'm just going to feel your face. I don't feel any crepitus. Feels normal. His ears are in alignment. His eyes are in alignment. I'm going to go ahead and check your TMJ. Can you open your mouth? Okay, can you move to side? Any pain while doing that?
No.
Okay, I'm going to go ahead and check your sinuses. Are there any pain when I do this? This is his frontal sinuses.
No.
His ethmoid. His maxillary.
No.
Okay, while I'm here, I'm just going to go ahead and check your black ball apparatus. Any pain doing that?
No.
His eyebrows and eyelashes are evenly distributed. I'm going to go ahead and look at your conjuncti. Looks good. It's clear. I see no injection. I'm going to go ahead and check your pupillary response. Okay, just look at me. Right now I'm checking to make sure they're constricting properly, which they are, and they are both consensual. I'm going to go ahead and check cranial number 2. Can you tell me if you see which fingers, just point which ones move? Very good. All right, I'm going to check cranial number 4. If you can just look at my finger and follow up. Very good. And I'm going to do the cover and cover test. You can hold this in front of your face. Okay, I want you to look at my nose. Okay, go in and cover. Okay, cover again. Okay, and cover. Okay, very good. What I'm looking for, if there's any fixation or deviation when he's staring at a fixed object. One more time. Okay, cover. And cover. Very good. Thank you. Sorry about that. This is getting tangled. Okay, I'm just going to let this right there.
Okay.
All right, I'm going to go ahead and check cranial number 5 with a cotton ball. What you're going to do is, I want you to close your eyes, and if you feel this, I want you to tell me where you feel it at.
My forehead, cheek, chin.
Very good. I want you to tell me, I'm going to put something next to your nose. I want you to tell me what it smells like.
Alcohol.
Very good. All right, I'm going to check all your ocular cranial nerves, and what you're going to do is you're going to follow my finger, and this is going to check cranial number 2, 3, 4, and 6.
All right.
Okay, so I'm going to do your 6 cardinal fields of gaze. Very good. Okay. All right, I also want you to tell me when you can see my fingers.
No. 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 No.
Very good. All right. This brings me to the conclusion of his cranial nerve inspection on his eyes. I'm going to go ahead and move to his ears. All right, so I'm going to look at his ears and make sure they are even, they're symmetrical, which they are. I'm going to go ahead and palpate his auricle. Is this tender at all?
No.
His lobes, they look good. And I'm going to inspect his canal, which looks great. I'm going to go ahead and look at his TMs. They are pearly gray. I see his umbo, his handle and the malice, they look fine. No bulging. And I will look in both ears and verify my findings. Okay, I'm going to go ahead and move on to your nose. His nose is midline. I don't see any deviation. I'm gonna go ahead and inspect his nares and see if his mucosa is pink. I'm looking at his septum. It's very pink. His turbinates are visual. They are pink as well. I don't see any discharge, any pain on that at all. No?
No.
Okay. I want you to go ahead and put your finger on one of those and on one there and breathe. Okay, do the other one. Just make sure that they're paying how much they are. Good. All right. I'm going to go ahead and move into the mouth inspection. I'm going to look at his lips, make sure they look moist, and which they do. Go ahead, I'm going to you open your mouth. Okay. It's going to inspect his buccal. And here it's very pink. I don't see any sores, any masses. His dentation is nice. His soft palate looks great. His flora looks great. His soft palate and hard palate looks great. Can you open your mouth and say, ah? Okay, can you move your tongue side to side? Let me inspect that. Okay, good. And let me look I'm gonna check your gag reflex real quick. Okay, good. He has a positive gag reflex. Also, his tonsil pillars are visible. They are pink. I don't see any extra or any cobblestoning on his posterior pharynx. I'm going to go ahead and check your hearing. What this is a Weber test. You're going to tell me if you can feel or hear this in one ear, both ears. Okay?
Both.
Okay, good. That's the Weber test. Next test I'm going to do is the Rhine test. So what you're going to do is the Rhine test, when we do this, you're going to hear the bone conduction. You'll hear the air conduction twice as long as you would hear the bone conduction. So you set it on his mastoid until he cannot hear anymore, and then you put it on next to his ear, see if you hear the conduction. This should be twice as long as the bone conduction, and I would do this in both ears. So, cranial number 12 is checked when you go ah. Okay, and cough. We're not going to cough. Okay, good. And also when I visualize his back, I could see that his uvula raised midline. There was no deviation with that, checking out all of his cranial nerves. And like that, I'm going to go ahead and do cranial number 11. I want you to raise up, 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 up. Okay, push, 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 and tongue out. Again, left. Okay, no deviation for 12 and 11, so that completes the cranial nerve evaluation. Okay. Now I'm going to go ahead and do your neck. So I'm going to look at it, make sure the trachea looks midline. When I'm looking, also I'm going to make sure I don't see any JVD distension, which I don't see any pulsation. And when I'm also looking and making sure I don't see any goiters from his thyroid. After looking, I'm going to go ahead and fill. And I'm going to go ahead and fill his thyroid and make sure his trachea is also movable, which it is. Can you take it, can you swallow? Okay, good. I'm just going to go ahead and check his thyroid out. Alright. It's non-palpable. Right here I'm also going to fill his carotid. It's nice, it feels regular, it's not bounding. Very good. Alright, I'm going to go ahead and fill all your lymph nodes, your occipital lymph nodes. Any tenderness when I do this?
No.
Your preauricular lymph node?
No.
Post-auricular lymph nodes, tonsillary, submandibular, mental, pre-cervical, post-cervical, and your supraclavicular. None of them hurt when I did that.
No.
None of them were palpable, which is completely normal. Alright, so I'm going to go ahead and listen to your carotid artery. I'm going to listen for any pulsations or bruits. I'm going to do this on both sides. And also while I'm here, I'm going to go ahead and listen by his thyroid and see if I hear any bruits as well. Hold your breath. Very good. Breathe. Okay, one more time. Hold your breath. Good. And again, when I hold his breath, I could hear it better. Your carotid artery is better. Alright, next I'm going to go ahead and move to your arms. When I'm looking at your arms, I'm making sure that they look muscular. I don't see any deviations or any abnormalities. I'm gonna go ahead and move down. He has good color. I'm gonna check his pulse, his capillary refill, which are less than 2 bilaterally. I'm gonna go ahead and check his radial pulse. It is nice, +2. Okay. I'm also gonna check and make sure his fingers are where I don't see any clubbing, which I don't see any evidence of that. That's good. Okay, I'm gonna go ahead and check your muscular strength. Can you put your arms out like this? Okay, I want you to resist. Good job. Okay, resist. Okay, good job. Go ahead and relax. That concludes his inspection. Now what I'm gonna go ahead and do is move down to your abdominal area. I'm gonna go have you lay flat. Oh, goodness. Sorry about that. I'm gonna get on the side so you can see me better. Alright, so I'm gonna go ahead and look his abdominal area. I'm inspecting the color. I don't see any modeling. I don't see any pulsations. His muscle strength looks good. Okay, I'm gonna go ahead and listen. I'm going to listen to all 4 quads. And go ahead and listen to his aorta. I'm listening for any bruits, also his renal arteries, iliacs. I don't hear any bruits. I'm also going to listen to femoral arteries as well. I don't feel any I don't hear any bruits. I don't see any pulsations. I'm going to go ahead and percuss his abdomen. It should sound very tympanic, timpani, and it should be dull over his liver and his spleen. I'm going to go ahead and palpate the area. I'm feeling for his liver, see if I can feel any borders. Feel his spleen, see if I can feel his spleen, which I don't. I don't feel any masses at all. I don't feel any abdominal hernias or anything. So I'm going to go ahead and deep palpate and see if I can feel his kidneys as well. Any pain when I do this?
No.
Okay. Any pain?
No.
Okay. Okay, good. Alright, so I felt no pain. I felt no masses and there was no tenderness on my palpation. And I couldn't feel any of the liver margins or his spleen, and his muscles look good. Can you raise your head a little bit? And I don't see any hernias. Okay. Alright, I'm going to have you set up. Okay. Alright, so I'm going to go ahead and move to your back so that you can swing this way. Yes. So we're going to move to his lungs, and what I'm going to do is the whole time I've been assessing him, I've been seeing how well he's breathing, and there's no stridor or anything. He's been equal respirations the whole time, and I'm going to go ahead and check for his lung expansion. So what I want you to do is take a deep breath. Okay, good. There's equal expansion on him, which is absolutely normal. And then I'm going to go ahead and check your diaphragmatic excursion. So what I want you to do is I want you to take a deep breath and hold it. Okay, and mark that. Okay. All right, that's good. Okay, mark this. Go ahead and breathe normal. Okay. All right, go ahead. I want you to exhale all the way. So take a deep breath and exhale all the way. And hold it. Okay, mark that. Alright, so go ahead and breathe normal. This is a normal 3 to 5, which I can still see, which it is normal. He is about 3.5 on this side. He's a little bit higher in his right, which is a normal finding for that. Alright, can you repeat that words? I'm going to check for tactile fermetus, and what he's going to do is say 99. Every time you feel my hands touching, I want you to say 99.
99. 99.
99?
Okay, I felt no increase tactile from arches, and it was completely normal, okay? His anterior and posterior are 2-to-1 laterally, which is completely normal for him. He's not barrel chested in the least bit. Okay, I'm just gonna go ahead and listen to you. And take a deep breath. I'm gonna listen to all lung fields and compare each side to one another. Deep breath. Okay, one more. They're clear. Clear. Lung sounds are clear away. Back, I'm gonna go ahead and percuss. I'm gonna do the lateral side as well, which I should hear resonance, and I don't hear any hyperresonancy at all. He's got no lung problems. I do see that you do have a scar here from your back. Looks like you had surgery.
Yes.
Okay. All right, I'm gonna go ahead and have you swing around for me. Okay. So again, I'm looking at his chest, make sure there's equal rise and fall in his respiratory effort, which there is. And I'm gonna go ahead and repeat when my tactile forces, and when I put my hands on your chest, you're gonna again say 99.
99? 99? 99?
Okay, that's completely normal. So now I'm gonna fill his precordia and his point of maximum impulse, which I do feel that. Okay. All right, I'm gonna go ahead and percuss as well. Okay. That's completely normal as well. All right, I'm gonna go ahead and listen to your apical pulse. First, I'm gonna listen to your aortic, pulmonic, hers, tricuspid, atrial, they sound good as well. I'm also gonna listen to your lateral lung again. Good. And good. Okay, clear. Good. His lung sounds are clear, normal. I see no pulsations or heaves or lifts. When listening, he's a normal S1 and S2. All right, I'm going to go ahead and move down to your legs. When I'm looking for the legs, I'm just appearing just the natural color, see if there's any modeling or discoloration between the two. I'm also going to check for temperature as well. They feel the same. I'm also going to look for edema, which I don't feel any edema. And I'm going to check his pedal pulse, +2. His tibial pulse is +2 as well. And we're going to check his popliteal pulse as well, which is kind of hard to, there it is, +1 as well. I'm going to go ahead and check your reflexes.
Okay.
And I will do it with my okay, just kind of relax. Okay. Okay, very good. I'm going to check his Achilles. Very good. And we did that bilateral as well. While I'm here, I'm going to go ahead and check his brachial. Do some circular consent, apologize. Okay. Thank you. Your reflexes look very well. I'm also going to look for his hair distribution, which looks completely normal. It's covering his skin color. His skin's, there's no bald spots that I see. It's very well displaced. All right, so if I can have you stand up for me. All right, so I'm going to go ahead and look at his back. I'm going to look for his curvature of his spine, which is fine. I'm going to check, make sure there's no tenderness, and make sure that it's aligned. Any pain when I do that? You can stand up straight. All right, and then of course you had back surgery, which I've seen that. It looks like he has full range of motion. Okay, and this concludes our head to toe assessment. Thank you very much.